Hi everyone, wanted to provide an update on what we know about coronavirus and some of the actions that are being taken by federal officials to address the coronavirus. We, as members of Congress, have been receiving regular updates, daily updates really, from top officials about some of these steps that are being taken. Just yesterday, the Vice President spoke with the Republican members of Congress. Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases, presented a report there. And that particular meeting also included some of the top officials from pharmaceutical companies across the country. So a few takeaways. One, the risk is still low. Pennsylvania has had no deaths from the coronavirus. In fact, we've had only 11 deaths in the United States from the virus. That, by the way, compares to about 18,000 per year from the common flu, so just to provide some perspective. Doesn't mean that we shouldn't be concerned, and we certainly are. Another thing about the virus, it seems to be affecting elderly people, and particularly people who have other health conditions are the ones where we're seeing the fatalities. It doesn't seem to be affecting kids too much who have it. And healthy adults. Generally the fatalities, again, are with elderly people. So you're seeing here in the U.S., many of the fatalities were one personal care home in Seattle, Washington. In response to learning that about the virus, federal health officials have increased the standard of care for personal care facilities. Of course, we have a lot of those in our district, and so personal care facilities management should be aware of the increase in care required, or the increase in regulation required, and be sure to comply with them. The federal government is going to hold off on all inspections except inspections specifically related to that issue for personal care homes across the country. The pharmaceutical companies who were there shared the progress, I guess, they're making in regards to finding effective treatments for the virus and also a vaccine. And they are making considerable progress in both of these areas and are really ramping up facilities to ensure that we are prepared to manufacture what could be millions of vaccines if this progresses in a way that it could. The Trump administration has declared a public health emergency, which ensures that all federal resources can be made available to respond. Congress, just yesterday, has stepped up. We agreed to a package that will provide $7.8 billion in additional funding. This is funding that would go to federal agencies and also to state governments to ensure that we're doing everything we can to develop tests and, of course, as I said, develop the vaccines and other treatments. There are a few steps that federal officials have been laying out to us that each of us can be taking right now to help to ensure that we're doing everything we can. Number one, wash your hands often with soap and water. These are fairly common sense, but important. Wash your hands often with soap and water for at least 20 seconds. And if soap and water is not available, use an alcohol-based hand sanitizer. Make sure it has at least 60% alcohol. Avoid touching your eyes, nose, and mouth, particularly with unwashed hands. When you cough or sneeze with a tissue, or sneeze into a tissue, then throw that tissue into the trash. Stay home when you're sick, and avoid close contact with people who are sick. Regularly clean and disinfect frequently touched objects and surfaces, and you can do that with just a regular household cleaning spray or wipe. Again, pretty common sense stuff, but very, very important to do at this particular time. So we also will continue to provide the latest recommendations. There are, as you probably know, some travel restrictions to specific regions, specific countries. And those are updated on maybe a daily basis as we learn more about the outbreaks in specific areas. That information can be found. There's a link on our website, and you can go to CDC at cdc.gov, or also to the Pennsylvania Department of Health, which is found at health.pa.gov. So again, I want you to know that we are watching this closely. Congress has stepped up with providing the additional funding, and I'm very certain that the administration is using all the resources available and doing everything that they can to ensure that we combat this disease in the best way possible. We're always available in our office if you have specific questions, and as I said, you can go to our website at any time. Thank you very much.